pretty good form.
For anyone who's watching this who's facing open heart surgery or anything to do with cardiac stuff, go for it. It has got a period. It's like getting a pair of shoes which are a bit tight. They're painful and you wonder how you want, and suddenly they all stretch and they're good. And this is what it's going to be. You'll have periods of difficulty. It will get better. Don't put it off because you hear scary stories. It's not. It's possibility of changing your life forever in a better way.
I think with people recently diagnosed with coronary heart disease, that it's important to recognise that you are likely to go through periods of emotional, psychological uncertainty. But make use of, your health professionals make use of friends and family and focus on the longer term, because whatever the diagnosis is, you're now in a position to manage it. But like a grief cycle, you can't really speed it up. It's a process that you need to go through, and sometimes that's easier than others.
If you've just been diagnosed and you're probably a bit freaked out by the whole thing, that it will get better and they can do amazing things, and it'll be a bumpy road, but it'll be worth it.
It's okay to be fearful because it is very strange for your body to go through it, particularly if it hasn't had anything like that before. So don't worry about trying to put on a brave face if you have visitors come in, or shy away from people if you're in the street with your scars and things. Be proud. Be proud of it. You survived. You're a walking miracle. So think of yourself as that.
The most important thing, consult your cardiologist and get the full picture of what you're at, and get him to explain exactly, and most cardiologists will do that. What is your condition? What part of the heart's been affected? Are you likely to need a bypass? Are you likely to need a stent? Are you likely to get another heart attack where 80% of your heart's damaged and you're living on borrowed time? And once your mind's been put at rest, where the cardiologist will say, look, really you had a heart attack, yeah, this and this part of your heart's damaged, but the rest of it's fine. And there's no evidence. In my case, when I did the angiogram, the rest of my arteries were clear, completely clear.
It's a very, very common operation, heart surgery, like bypass surgery. So, and the guys that I know that do it, the two main surgeons that I know that do it, are both doing like 2 people a day. So they really know their way around your chest and your heart. So you have to put yourself in their hands to get you through this immediate period. And once you've got through and you're feeling better, then you must look after yourself. And you must go forward and not, concentrate on being sick, but being well.
Yes.
So you're really the main person that controls your wellness feeling, I think.
It's come to my realisation that this can happen to anybody, especially when you start seeing guys coming into the rehab after you who are your same age as you.
Or younger.
Or younger.
Yeah.
Yeah.
I think that's really key. We didn't know the symptoms. Probably getting the message out about the symptoms, And if you have any doubt at all, you just go and see someone.
Yeah, they would, like the nurses said to me multiple times that they would rather someone come to the emergency or come in an ambulance 12 times a year than
nothing wrong with them than miss that opportunity.
Yeah.
From the observer's point of view, it can seem a bit confronting. There's decisions to be made. There's options to be considered. It's quite a daunting and a big deal operation. Make no mistake about that. It's how you view your situation in relationship to what's coming. You've got no real idea. They give you the information, but my words of advice to people is trust the information. It's pretty well researched, and by and large it follows the script fairly well. It's not going to be the most pleasant time you'll ever have, but you do come out of it, as Kelly as a typical example, you do come out of it very well on the other side.
Family and friends, if they're all supportive, even when you're gloomy and dull and boring, that is good. It helps you. It helps your self-esteem. It just helps the healing process.
Look after yourself, that's the thing. Make your life important, because it's the only one you've got. It's got to
And
be
I have to say,
important.
since I had my first surgery, I've gained 6 grandchildren, and so it's worth staying alive
Yes.
for that alone.
I really feel that I could tell people it's worth doing, even if you have fears, because I've got my life back, I've got my smile back, I've got my bounce back. So it's been terrific.